We're all so quiet.
I I think
We're
it's
being
more out of
live
shock.
streamed.
Good morning, everybody. We are live. It is Wednesday, August 18th. We're over halfway done with August. Can you believe it? Hi, I'm Jenny-Jaymes Gunn, and I want to introduce our producer and co-host, Christian Cano.
Hey, good morning, everyone. Thank you so much for joining us this morning. I'm Christian Cano, one of your co-hosts on Coffee Pan Dulce, along with Jenny-Jaymes Gunn, Barb Bacon, Mama Ruth, Stephen DeFiore. We hopefully will have Mama Ruth joining us if she can. I know she is starting something that she's doing now, and we do miss Stephen, but he did send us his questions for today's show. Maybe we can ask some of his questions. I'm Christian Cano once again. Today is the 18th. As Jenny said, halfway through August. Wow.
A little over half.
Yeah.
Already. We are so excited to have Dr. B back with us again today for today's show. We also hope to be joined by the Public Affairs Director, I believe, Dr. Meg Sullivan with Mecklenburg County Public Health, a medical director. We hope that she'll be joining us here as well. But before we do that, let's go ahead and salute to Coffee Pan Dulce. Is that how we do? I forgot. I'm lost my train of thought.
Let's just go with that.
Yeah, let's salute to Coffee Pan Dulce. And then we want to thank our Pan Dulce supplier sponsor, Manolo's Bakery. Manolo's Bakery on Central Avenue. Please visit your Black and Brown small businesses or any small business during this global pandemic to help them out. So let's go around the Brady Bunch screen, introduce yourself and your imaginary button so that way we can share. I can share us on the social media platforms. And I don't know why I'm laughing. So let's go, Jenny, Dr. B, and Barbara.
Okay.
Is that okay? All right.
All right. Hi, I'm Jenny-Jaymes Gunn. I am a LGBT and community advocate. I do volunteer work with Charlotte Pride, the National Organization of Women, and many other organizations. And, if I was wearing buttons, which I wouldn't with the shirt, but if I did, it would be Believe Women, healthcare for all, Medicare for all, whatever name you want to give it. Everybody deserves the human right of healthcare. Let's just chalk it up to that, and we shouldn't have to pay for it. It should just be built into our society. Yep. I think that's a big one. I mean, if COVID didn't teach us anything, we should learn that we need healthcare for all. We need the human and dignified right to be able to walk into a clinic and get our lives saved. And just as simple as that. Dr. B?
There you go. I couldn't agree more. I'm George Bohmfalk, a retired physician. My primary advocacy now is Medicare for all. And my second, which I'm kind of a little late to the table to, like most of us in America, just starting last year, is that Black Lives Matter. And we need to do all sorts of things to remedy this scourge on our country that began with slavery. So those are my two main advocacy interests.
Hi, good morning. I'm Barb Bacon. I'm a healthcare and community advocate here in South Charlotte. My buttons are very similar, healthcare for all. I am still very concerned about the gun violence. My boyfriend is going to run in the Chicago Marathon, and we're being told all these things we can't do this time because of the violence there in Chicago, but we're going anyway. So, and Black Lives Matter. I have a niece and a nephew. So there you go.
Excellent. Well, thank you very much. I'm Christian Cano. My buttons are Trust Women, Medicare for all, Healthcare for all, right there. Moms About Action, Gun Sense Legislation. And then in my heart, I have a button for our young man who was on our show for many months, several times, who passed away this January. So we do want to go ahead and talk about today's topic is, what is a LatinX COVID-19 cuckoo? That was my polite way of saying kook. So, but I want to be careful because I don't want to, this is a very serious topic. I guess I'm a little bit frustrated that people still have questions about COVID and masks.
Hey, Christian.
Yes, ma'am.
if you were going to be careful, that would have started a long time
Oh,
ago.
that's right. That's right.
I
Well,
mean, not to point out the obvious, but
That's
I
true.
just,
Oh,
I mean, you can
gotcha.
dust your back off. I read
Yeah.
that bus right over you just a little bit,
That's
but I
true.
mean,
That's
that ship left a
that's-
long time ago.
that's true. So we are going to talk about that, but before we do that, just in a couple of minutes, let's talk about our 3 current events. If you want to comment on these very briefly, please do. In Texas, Governor Abbott, we found out yesterday, Governor Abbott tested positive for COVID.
Of course.
So we'll leave
Yeah,
that out
what a
there.
surprise.
Yes, America, Afghanistan, we're pulling out of Afghanistan. We should be out by August the 31st, I believe, the end of the month. But I understand the Taliban has taken, I don't know if you even want to comment on that topic. And the Mecklenburg County Commissioners should be voting this evening, which is timely for our show, whether to have a county emergency, so that way the cities can do a mask mandate. And my understanding is we're like 99% sure they're going to vote yes. And the city of Charlotte and Mecklenburg County have already signed an agreement that mask mandates will start tonight. So, which is hopefully Dr. Meg Sullivan is able to join us. Maybe we can get some clarification on that. So those are the 3 topics. Anybody want to comment on any of those?
Well, and you left out that the country's burning up, and,
Oh, yes.
we're out in Colorado this summer, and usually we just have these beautiful views of these mountain ranges. And there have been many, many days where we look out our window and the mountain has disappeared. We can't even see
wow.
it. I mean, so the smoke.
Yeah.
I mean, and I understand it's reached Charlotte as well on some
Yeah.
days. I mean, so
I didn't know that.
those who continue to deny climate change,
Yeah.
it's like well, good for you.
Yeah.
Yeah.
Ignorance is bliss.
Jenny?
On Governor Abbott, as far as him getting COVID, I always hate to hear that. Whether they're a Republican or a Democrat or whatever, I can't say there isn't a delicious irony to it, and I hope that the 200 or 300 other Republicans that he was sitting in a room with the night before all go get tested, because they had another one of their maskless super spreader events the night before at the country club. So I'm sure if he had it, there's probably several others that probably got it as well. As far as Afghanistan, we never should have been there. Then we wouldn't have to do a pullout. The colonist imperial thinking of the United States and thinking that we can run other people's lives when we can't even give away free shots in this country. I'm just going to leave it at that. We shouldn't be running another society talking about freedom when we still question reproductive rights, LGBT rights, and we can't even distribute shots to adults, supposed adults. So that's just, I mean,
how about the mask vote?
On the mask vote, long overdue. I don't think we should have ever lifted it in North Carolina.
Excellent. Dr. B or Barb, you want to comment on any of those current events?
Go ahead, Barb.
Texas, what a surprise. Isn't he lucky that there's monoclonal, I can't say it this morning, plasma.
Yeah.
But that's experimental. So all these people that argue, they're not putting any shots in my arm, but boy, if they get COVID and they're going in, they're going to dump a whole cocktail on those bad boys and hope they live. So I just don't get it. I stood in line at the grocery store the other day and I'm like, and this guy did not have a mask on and I'm like moving away from him and I don't know. So anyway, I hope the people get tested and I certainly hope it's not a super spreader, but I would not be surprised. Afghanistan, very, very sad. One more thing on Biden's plate. How many more things on his plate can he handle? I'm getting very worried for him. And people there, I just saw that they've been talking to the generals for months. Let's get going. It takes too long to evacuate. Now we've waited too long. So it's really scary and sad. And I don't even remember what the vote. Yep. I hope they say yes. I never stopped wearing a mask. I'm way too conservative on that. My allergies were so much better. I didn't really care about anything else. So I'm done.
Excellent. Thanks, Barb. Dr. B, you want to comment on any of those? He's like,
No, I always try to take the long view in these things.
Sure.
And what I'm seeing is that, to say we shouldn't have gone in Afghanistan in the first place, we basically did squash the Taliban for a while. 20 years worth of women and girls have gone to school and taken jobs and had a taste of liberty and freedom. And, so maybe things aren't going to go back to the old Taliban. I mean, I try to be the eternal optimist here. And, a 20-year window of relative freedom is a pretty powerful immunization. And so, I think it remains to be seen. It may not be quite as catastrophic as we expect, although it may. So I'm holding a reserved line about that.
all right. Anything about the mask or
Sure, yeah. Heavenly days, yeah.
Oh,
Everybody
yeah.
needs a vaccine. Everybody
Okay.
needs to wear a mask until we squash this thing.
Excellent.
What do they say? Full stop. There you
Yes,
go.
yes. So with me, I'm not surprised Governor Abbott in Texas tested positive. I do hope he recovers, but it is just, I don't know. I called my dad when I found out from Jenny yesterday, and they started yelling at my stepmom and my dad started yelling at each other in the car, that idiot, and this. And I'm like, I just wanted to let you know. And then Afghanistan, I'm so glad we're pulling out. It's never going to be a good time to pull out of Afghanistan. So let's just do it, and let's. But it is heartbreaking to see the things. The mask vote. I agree with everyone else. I hope they. I believe they are going to be voting yes, but I hope they do. I never stopped wearing a mask in many areas, but I think this just helps other people as well. So what a timely time to introduce one of our other guests who have joining us, Dr. Meg Sullivan, the Public Health Director in Mecklenburg County, I believe. Dr. Sullivan, welcome to our show. We just went over the current events. I don't know if you want to introduce yourself to our audience.
Sure. Thank you for having me. My name is Meg Sullivan. I'm the medical director at the health department. Happy to be here and happy to answer any questions.
Excellent. Thank you so much. Well, today's topic is what is a LatinX COVID-19 cuckoo? Once again, I said cuckoo instead of kook, but there are very valid concerns. I know we had a conversation right before the show, Jenny and Dr. B and I, about taking these concerns seriously. We really wanted to spend some time trying to debunk some conspiracies that we've heard or about masks and so forth. As I mentioned, I am just shocked that we're in August 2021 and people still have they're still believing some of these things, but they are. Having spent a month in Key West this year and last year, where they are very, very strict with masks. You can't even, their rules last year is you had to wear a mask even outside. So that way they could cut that loophole out with people saying, well, I'm jogging or I'm doing this. And then they give you a ticket if you're not wearing a mask and you have to prove it in court to get out of the ticket instead of saying, well, I have a medical reason. So I know that that's not something that we probably could do here in Mecklenburg County because just the amount of people we have, but I liked that. So with that said, Dr. Sullivan, I understand that the Mecklenburg County commissioners are going to be voting today or during today's meeting. And is their vote to do a public for the mask or what are they actually voting for? I guess we're a little bit confused.
Yeah, so it will be a public meeting. And I think there are two things that are happening today. The first is that a joint proclamation will go into place between Mecklenburg County and the city of Charlotte. So Mecklenburg County, the unincorporated areas of Mecklenburg County that do not fall in one of the cities or towns. And then the city of Charlotte will put a mask mandate in place today. And then what the Board of County Commissioners is voting on is to institute a public health rule, which is based on recommendations from the health department and from the policy group that represents, a lot of different representations from the hospitals, from the cities and towns, and from other public health and medical experts to have a mask mandate in place for the entire county. But that will not go into place if they vote yes, and that vote will happen later this afternoon. If they vote yes, that will happen in 10 days from the time that they vote. But so it's expected today, again, a joint proclamation for the city of Charlotte, as well as the unincorporated areas of Mecklenburg County. So that would include all county buildings and county property to have a mask mandate in place effective today until if it's voted on yes, the public health rule goes into effect in 10 days.
Excellent. Thank you. Does anyone have any questions about that before we start asking the exciting questions? Okay, all right. Well, so let's jump right into it. Dr. B and Dr. Sullivan, please feel free to jump in anytime if you want to answer these questions. One of the questions, let's just do the low-hanging fruit. Does COVID-19 shots come with microchips? I'm almost embarrassed to ask that question, but we've got to ask that question because apparently that is still a belief. Anybody want to answer that question? I don't mean to laugh, but I'm just Dr. B or okay. Well, I assume that was
Silence, what does it tell you?
yes, okay.
Right. I am happy to definitively say that COVID-19 vaccines are incredibly safe and effective.
Sure.
They've undergone rigorous scrutiny that just like
Sure.
every other vaccine that we know the United States has, the safest vaccine supply in its history right now, given the rigorous scrutiny. There are no microchips in the vaccine.
Excellent.
Well,
Thank
that's
you.
a shame. I was hoping to get Disney Plus out of that. So I'm just kidding.
Hey, Jenny, you want to ask the next question, and then Barbara?
Yeah, I do. The vaccine, does the vaccine alter your DNA?
No. Dr. Sullivan can probably speak more formatively than I can, but fundamentally, no, it doesn't alter the DNA. And we've had vaccines, for an awful long time, different types, and this is not a live vaccine, it's not even a vaccine, it's just a little fragment because we've learned so much in the past 30, 40 years that we can now do things that are much safer with vaccines and kind of fooling the virus into kind of thinking that it's, being attacked, and so therefore it builds up all these defenses, but it's not changing anybody's DNA. It's simply kind of like, in a certain way, it's kind of like an antibiotic. You kind of take it and, it solves the problem, but it doesn't permanently alter anything.
Dr. B, you may need to adjust your headbuds because you're muffled again. Sorry about that. Yes, there we go.
Well, we'll see.
Oh,
New
what's
problem.
that?
Whoa, incredible. Okay, Barbara,
I understand.
what's your question?
One of my questions. I have been in an argument with a niece that I've always thought was very bright, and she's been vaccinated, but she sent me this podcast that has a group of doctors, and I think it's one of those fringe group of doctors. Women, when they get the vaccine, it doesn't impact their reproductive process, but it will impact their girls' babies. So it skips a generation, and they have facts to prove it. And I'm going to send you that podcast version so you can put it on the website. But
Okay.
3 hours of listening to total
Wow.
nonsense. And I'm not a doctor, but I mean,
Yeah.
it was just ridiculous. So
Is any of the doctors want to comment on that? I guess.
Yeah,
Go ahead.
I'm happy to say that, I think when the vaccines were first approved, there was a lot of questions around kind of pregnancy and fertility, right? And I think at the very beginning, when the vaccines were authorized, but it was, very important to be transparent that initially we didn't have specific data about the vaccine for pregnant women, just because as is standard practice for all vaccines and medications, women who are pregnant or breastfeeding were excluded from the clinical trials. We now have very specific data to the point that the CDC, the American College of Obstetricians and Gynecology, and other leading women's health and reproductive health organizations have come out and said pregnant women should get the vaccine because there is real clear evidence that it is safe, that it's effective, and it's important. So that, just to clear that up. Sure. I think this question here, or the claim that somehow the vaccine would then influence cause any risk to the infant is there's no evidence of that whatsoever. There is a little bit of evidence actually that antibodies from the vaccine or from the mom that she produced from receiving the vaccine are passed on to the infant. So there is some evidence that perhaps the baby does have some level of protection. We don't know exactly what that means, but no evidence that there's any risk to the infant for the vaccine, and certainly no evidence, nor any that I know can think of pathophysiologic or explanation for how that would impact kind of future generations.
Let me speak for just a second to this issue of doctors said, because there are an awful lot of these, like you say, back in the beginning. I mean, Fox News regularly had these esteemed doctors who would come on and talk about hydroxychloroquine being so great and all these other really kind of fringe kind of positions and beliefs. And I read something the other day about how a chiropractic group is coming out and telling people the bad things about the virus and the vaccine and whatnot. And it turns out that the world of chiropractors seems to be somewhat divided into two camps. And it seems that the fellow who basically created chiropractic medicine up in Iowa back in the early 1900s or something did not believe in the germ theory. I mean, so that's a pretty fundamental departure from medical science if you don't believe that germs and bacteria and viruses even exist. And so he created chiropractic, and then over the years, my understanding is that chiropractic kind of divided into those who were more scientifically oriented and those who, like its founder, were non-scientifically oriented and went with all this manipulation and no medicines and things like that. So it stands to reason that a large portion of the chiropractic community, the chiropractic doctors, are kind of not scientifically oriented, and it appears that that's the source of these statements from doctors, many of them, with these kind of inconsistent comments and opinions about the virus and the vaccine. And then in addition to that, there are MDs and doctors of osteopathy, scientific doctors who are just kind of fringe. There's always going to be some of those. There's some scientists that don't believe in global warming. So there's always going to be a few, but the absolute overwhelming bulk of credible, legitimate scientists certainly agree with everything that Dr. Sullivan said, that the vaccines are safely developed. They are totally proven to be effective. And that there's just essentially no concern whatsoever. That your far greater concern is exposure to the COVID, to actually getting it and being sick or dying. So,
Dr. B, that's what is so confusing, I think, to so many of us who believe our doctors and trust science and so forth. It's confusing to us because being grown up, I want to trust the experts. I want to trust the doctors. It seems like we have, and Jenny, we were talking about this right before the show, we have a certain section of our population, and our Latinx community is no different. Once you get past the second generation, they're like any other Americans. They believe certain things that they see and so forth. What do both of the doctors think? What are the groups that are still hesitant about masks and about vaccines? So apparently I have 3 members of my family, my big family, that are. I'm curious, what are y'all hearing about what are the groups that are still hesitant?
Well, they're the ones we all kind of know about. A lot of them are politically oriented, and they kind of just believe kind of what the tribal chant is, coming all the way from Trump and his lack of acceptance of the reality of the virus and whatnot, even though he got vaccinated, even though he had COVID, right? But he's, shamefully still not been man enough to kind of come out and say, yeah, this is what happened to me. And I really encourage everybody. Anytime he said anything, he then qualifies it. Well, but it's up to you, And then there folks whose cultures have had negative experiences with the government, like the Black people who were subject to the Tuskegee syphilis experiments back in the 30s and 40s and whatnot. It's just unconscionable. You can understand how somebody from that community might be a little bit reluctant to trust the government that's telling them to go out and get this vaccine. And they're the religious groups and whatnot. So Dr. Sullivan might have more insight into other kind of groups and mindsets that are resisting this.
Yeah, I think it's always important. I think one of the things that we try in public health, right, is to create those spaces to have kind of those reasonable conversations, right, and to understand that people definitely have questions and are probably confused many times because this is a brand new virus, right? And yes, there's so much that we know about respiratory viruses. There's so much that we know about vaccines. I mean, there's so much that we built upon. It was a brand new virus that has behaved in ways that we did, are just learning, right? The Delta variant, so many different things. And so guidance has changed. And I think for some people, right, that has been understandably hard. And I think has led some people to maybe then not trust as much, right? When the guidance may say one thing and then changes. And I think though, creating those spaces to have the conversation to be able to explain that, right?
Sure.
That we are learning, right? I think it's really important to be transparent, right? We're learning as we go. And as we get to a different phase of the pandemic, right now I know that before we were at a phase where, vaccination was so highly safe and effective and saw that steep drop in cases that, this understanding that your risk of testing positive or passing it on when you are vaccinated was so low that it felt, okay to say, maybe you don't have to wear a mask. And now we're saying, right now you have to, but that's not we're not in the same situation. We now have an incredibly highly contagious variant that is spreading so rapidly because we were unable to get enough of our population vaccinated in a quick enough time to allow that to happen. So I think some people say, well, we're flip-flopping or changing our mind, but it's not. It's making the best decision based on the science and data that's available at that time. But so I think, though, understanding why people may not immediately follow guidance or question it because it changes is really important, but to create spaces where we can have those conversations and explain why, and to say why this is why it's so important right now, and to really focus on the data. I mean, unfortunately, right, the data shows, the number of people testing positive, our hospitals are full, people are still dying. Those are reasons that we need to make these decisions based on that. And I think the more we can emphasize that hopefully the more buy-in that we'll get.
Thank you.
And just as a little side comment on current events, I think there's a certain analogy with the Afghanistan situation. Everybody said, oh, we should have been prepared better. Oh, we should have pulled out sooner. Oh, we should have done A, B, C, D. Things change on the ground. And just like with the virus, it's hard to explain to even medical people all of these new developments for heavenly days. To try to get lay people to understand why these recommendations are changing is nigh unto impossible. So unfortunately, kind of like with Medicare for All, I think trying to get people to understand it and support it is going to be less successful than just kind of saying, okay, by God, we need a mandate. We need to get a vaccine mandate. We need to have a mask mandate. Let's squelch this, and we could argue about it for time immemorial. But let's just solve the problem, and rather than kind of getting the kumbaya moment of everybody kind of holding hands and say, yes, we all agree on this. I think that day is past.
Jenny?
I have a question. It's based on another common misconception of the vaccine. Can the vaccine actually be shed from one person to another?
What do you mean by shed?
Like with a live virus, you have the shedding phase of the deal. The big deal is in a lot of conspiracy theory circles is that the vaccine would be able to shed that same way.
Go ahead, Dr. Sullivan.
Yes, I mean, so again, I think that's an answer where I can definitively say no. The way that both of these vaccines, the mRNA vaccine and then the Johnson & Johnson vaccines work, they are not live vaccines. They have no COVID virus in them at all, right? What they do is they contain instructions for your body to make a very small piece of a protein that resembles the protein on the surface of the SARS-CoV-2 virus, which is the virus that causes COVID-19, so that your body then in turn, your immune system sees it, recognizes it, says you're not supposed to be here, creates antibodies so you're protected if you're exposed in the future. That's all the vaccine does. So it stimulates your body to make those antibodies. It has no COVID in it. It also, as we know, the vaccine has incredibly strict storage and handling requirements, right? It has to be kept at very specific temperatures. It has to be monitored. Once you open a vial, you have to use it in a specific amount of time. And that's because the vaccine itself is just an unstable product, meaning that once it enters your body, it does its job very quickly, again, stimulates your body to make those antibodies, but does not stay around, right? So again, going back to, right, does not alter your DNA, does not have that kind of those impacts that we talked about, and definitely does not shed or pass on to another person. We'll say, right, is by getting the vaccine, you have that level of antibodies and you're more protected. So your likelihood that you pass COVID to another person is much less. But that's the only kind of, impact that the vaccine has in terms of passing things. It's actually trying to decrease the risk that you transmit the virus.
And I had a follow up to that one because these two questions are kind of connected. So is the vaccine causing more variants? Is COVID driving? It's a very common one, and it was a Nobel Prize winning French virologist, Luc Montagnier. He actually is an anti-vaxxer, and he was saying the COVID-19 vaccines actually are creating and driving variants. We do, it's kind of, I haven't heard this one very often, but I heard it early in the spring, and then it kind of went away, and then I've heard it in a few. I subscribe to a lot of different chat things, including some things on Reddit. I always like to know what the other camp is thinking. So I slog through hours of tinfoil hats and cookery, because I just think it's fascinating. I just love it, and I love YouTube. But
Jenny, do you realize that your life has just become utterly pointless? That's what you're going to spend it to. Let me use another current event analogy, and that's this wildfire that's going on in California right now. Let's say that that wildfires can develop new forms. Well, so if we put water on them and put them out, that's going to prevent them from developing new forms, right? And if we kind of let them burn, well, these new forms are going to kind of happen. So no, the vaccine absolutely does not lead to new mutations. The vaccine squelches the virus and prevents it from growing and evolving and developing these new mutations, because it's running rampant and has that opportunity to reproduce and create these variants. I don't expect non-scientists to understand all this virology, mutation and whatnot, but think about it as almost as a birth defect. Every now and again, people have a baby and it's got a birth defect. Well, that's the same thing that's kind of a mutation in some form. And the virus kind of keeps replicating, keeps reproducing, and every now and again it has a birth defect, and God forbid one of those birth defects is that it's resistant to the vaccine, right? And so the best way we can prevent that disaster from happening is for everybody to get vaccinated and basically kill the virus. So put out the fire so that it doesn't have a chance to develop these new mutations. So that's the cause of it. The vaccine is our only solution to that. It by no means is causing variants to develop.
Barb?
I can't find my list.
Oh, that's okay.
Sorry.
I was just going to comment on what Jenny said as well. I mean, I think these are really, I know I shouldn't be chuckling, but there are people who believe, not necessarily believe these things, but it's like they're looking for reasons to not get the vaccine. It's like when you lose, you're trying to lose weight, and you're just looking for a reason not to get on the treadmill. Well, it's raining outside. This is more serious because it's a very preventable situation now. By wearing masks or getting vaccines, but we have a large portion of our population, especially within our Latinx community, they're still hesitant. And so I don't know, Barbara, you have a question?
No, I'm good.
Okay, so that's a question, Dr. Sullivan. How is our Latinx community doing in Mecklenburg County? I know when we first started talking about this with Dr. B was in this house. We talked about COVID-19. I don't know if you remember that, Dr. B, and then we went virtual after the shutdown started. There was a lot of hesitation. We were calling it the Corona Dos Equis virus, and we were kind of joking about it and stuff. And how is our Latinx community doing as far as percentage wise, as far as vaccines and all that kind of stuff?
Yeah, so I think I'll first say, right, we know that unfortunately this virus and the pandemic has impacted, everybody in so many different ways, but we know in particular our Latinx community was especially hard hit, especially a few months in, just some of the disproportionate numbers and percentages that we were seeing. It was just, absolutely heartbreaking. And I think, obviously a lot of work has been done, especially by community leaders, to really minimize that impact. And I think once we started providing the vaccine, we again, especially with the initial data, saw some disparities or disproportionate uptake and lower numbers by the Latinx community. What I will say is I think over the last couple of months, that data has really significantly improved. And now the percentage of individuals in the Latinx community who have been vaccinated is relatively close to the percentage in the non-Hispanic community. So I think that that's good. I think that's right. The work of a lot of community leaders, again, vaccine providers really doing that and really trying to get the information out of just how important the vaccine is, how safe and effective it is. And I think, that speaks to when you look at our data right now of who is testing positive and kind of our hospitalization and death data, that really high disproportionate impact that we saw in the Latinx community before, we fortunately are not seeing that to that degree now. And I think that really speaks to, again, the vaccine and the impact of that. So I think positive news, but just I would say within our entire community in Mecklenburg County, still a lot of work to do, right? We are not near the percentage where we need to be. People, again, are still getting sick, being hospitalized and dying every day. And so still work to do, but we have made significant improvements.
Barbara?
Dr. Sullivan, how long before the medical community will have enough data to tell people that have been vaccinated and get COVID if there are any long-term effects? I'm hearing that, and people are wondering, and they're not even saying that you're changing their mind. The non-vaxxers say, oh, well, see, the vaccine doesn't work. That's why you got it. No. And I don't even waste my time arguing with them, but I know 2 people now that are vaccinated that got COVID, and they ask me, and I'm like, I don't know. I don't know if they know. So do we know, or what do we know?
Yeah, I think so. If I understand your question correctly, I think first, right, what we can say is unequivocally, right, we have enough data right now where I can confidently say that the vaccine, if you get vaccinated, your risk of testing positive is much lower than if you're not vaccinated. Unfortunately, right, we know, especially with the Delta variant and the amount of virus that is in our community, because we didn't have enough vaccination coverage, there still is a risk that you test positive even if you're vaccinated, but your risk is lower. We can still say that. Also, again, based on data at this moment, based on the virus that is in there and the way that the vaccine is working, if you're vaccinated, your risk of having severe disease, having to be hospitalized or dying from the virus is much, much lower than if you're not vaccinated. So I feel like we have enough information to say that. But I think your question might be is understanding, though, that the vaccine is not 100% effective. And I think we always, right, have to be transparent about that. But if someone gets vaccinated and tests positive, their risk, and tell me if this is what your question is, of developing what we know that unfortunately some people do of long-term symptoms or complications from COVID compared with somebody who has not been vaccinated. Is that what the question was?
Yeah. Yes.
And, I think the honest answer is that we don't have enough data right now. And I think that was your question, right? To definitively say, nope, your risk is much lower. I think what we know is just by having a reduced risk of infection and it does seem, again, we're still learning about this, but people that test positive are infectious, if they've been vaccinated, are infectious for a little bit less time, potentially, that, the chances might be lower. But I think that answer, we just don't know right now. And so that's why, right, if you do test positive, regardless of your vaccination status, the guidance is still the same, right? You absolutely have to isolate, right? You have to kind of follow all of those criteria, notify close contacts, all of those things. And I think we don't know. But that doesn't mean, though, right, that the vaccine is not important, because yes, recognizing that that you may still test positive, but your risk is so much lower. And so go ahead and you should get vaccinated and not take that chance.
Okay. So as a follow-up, I personally was with a family that were all vaccinated. I'm very good friends with them. We don't wear masks. A brother comes and was there, and he went to college and took his daughter some furniture, and he comes back, stays overnight. I show up, he's leaving. I get a phone call. Ed's going to get tested. His daughter has COVID and she's been vaccinated. So I'm like, okay. So I had no symptoms. So I went to my local pharmacy and I said, I want to get tested. And she said, no. Do you have any symptoms? No. Do you have any fever? No. So I want you to wait 5 days, take your temperature. I said, do I quarantine? She says, yes. She told me 5 days. Somebody else told me 10. What's the number? And we found out that nobody is positive except the daughter. And she's in a college environment, so masks are not mandatory. So I guess that's how she got it. But what are the quarantine rules for COVID now? Is it still 14? Is it 10? Is it 5? I am hearing all kinds of different numbers.
Yeah, and I think it's it is confusing, and a lot of it is based on whether or not you're vaccinated now, and then what your ability is to, if you are in public, adhere to some level of measures. And again, I think it's trying to find that exact balance between wanting to prevent spread, and so that's the point of quarantining, right? If someone meets a threshold to the point that they were exposed at a high enough level or have a high enough risk that their chances of testing positive is higher than somebody who wasn't in that situation, that they need to stay away from others so that if they do test positive, they're not spreading it. So the guidance, again, though, depends. So obviously, just to reiterate, right, if you test positive, regardless of whether you're vaccinated or not, you need to stay home and stay away from others until it's been at least 10 days since either your symptoms started, if you have symptoms, or if you tested positive, if you didn't have symptoms, and your symptoms have to be better and you have to be fever-free for 24 hours. So that 10 days applies whether you're vaccinated or whether you're not. That's for individuals who test positive and need to isolate. If you are exposed, and so if you have close contact with someone, meaning, and right now the general definition is being within 6 feet of someone for a cumulative total of about 15 minutes over a course of a day, your level of risk goes up to the point that we say, okay, right, that's considered to be a close contact. If you're vaccinated, however, though, understanding your risk of testing positive is not zero, right? Just as none of ours is zero right now, just because we are all living in a society where unfortunately there's a lot of COVID. So your risk is not zero, but because you're vaccinated, that risk is low enough that at least at this moment, as long as you don't have any symptoms, you don't have to quarantine.
Okay.
So you can go about, right? You can still go in public, but a couple of things are really important. The first is just as we all should be doing, but someone who has this should especially do it. You should be wearing a mask at all times. You should be avoiding, right, high-risk situations. You should be trying to socially distance. And if the first second you have any symptoms, you should stay home, right, and isolate. The other thing that is a recommendation if you're vaccinated and you're close contact is that you still go ahead and get tested. Again, you don't need to quarantine before you get tested or while you're waiting, but you should do that. And that recommendation is about 3 to 5 days after exposure. And the reason for that 3 to 5 days is understanding it takes a little bit of time, right, for your body to, if you become exposed and are going to go on to get infected, to develop enough virus to be able to test, but wanting to test early enough so that if you did test positive, right, knowing that you're not quarantining, that you catch it and then you isolate.
Okay.
If you're not vaccinated and you're close contact, the recommendation is that you do quarantine, right, and that you stay away from others and try and prevent spread, and that you get tested 5 to 7 days after exposure. And again, I know it's confusing because it's a little bit of a different time, but it's to allow a little more time for you to test positive, right? And to pick up and understand that in the meantime, you can allow that time because you're not around others and you're quarantining. In terms of how long you have to quarantine, the safest time to quarantine, the least risk, is 14 days. Because the studies have shown, right, what we know about the virus is that if you're exposed, it takes somewhere between 2 to 14 days for you to develop symptoms and test positive. So to be absolutely on the safe side, it was 14 days. But a recognition that 14 days is a really long time for a lot of people, especially people, right, that need to work or, do other things. And so there are 2 other options that individuals can choose to do, which is either do only 10 days or go do only 7 days as long as you test after 5 days and have a negative test, with a recognition, though, that you still are at risk of developing symptoms. And so you need to be able to strictly adhere to all those precautions I just talked about, right? So wearing a mask, socially distancing, and those things. Okay. So for certain individuals, right, who work in very high risk settings or are unable to socially distance, right? So this is why in the childcare setting is a good example, right? We know a 2-year-old can't necessarily do that. They should quarantine for 14 days. But if you have the capacity to get tested after 5 days, you are asymptomatic, your test is negative, and you can return to a workplace setting where you can put in very specific precautions, right? Then that's what the quarantine period is. I know it's a lot of information, but I think it shows, I think, really trying to do it again based on the data and the science, and
Yep.
do that risk assessment. We're all at risk, some level of risk. So we all need to be doing, right? And this is why public health, including me, supports this mask mandate at this time. So we just have too much virus and we need everybody to be wearing masks at all time and adhering to precautions. But if your level of risk is higher, then again, to take those additional precautions based on your risk and to try and mitigate it as much as possible.
Dr. Sullivan's answer is exactly spot on. It's exactly what we expect from a science-based, open society, responsibility and all that. It also speaks to how nearly impossible it is because, as she said, it's complicated and the typical layperson can't keep track of, oh, was it 10 or 14 days and all this kind of stuff. And so that
Yeah, I know.
brings again this contrast between an open, free society and a secure, protected society.
Sure.
And it reminds me of the ex-governor Schwarzenegger's comment on something the other day where he said, screw your freedom, go get vaccinated and wear a mask. That kind of cuts to the chase. You can have an authoritarian protecting you by mandating that, or you can have, the more open, like we claim to like, notion of giving everybody the facts. But it has limited effectiveness because it's complicated because people just kind of can't follow it.
Hey, Jenny, last question, because then we want to wrap up. We value everyone's time here. Go ahead.
Absolutely. It's on masks. And again, it goes back to debunking conspiracy theories is two things on masks. One, that masks make you sick. The second one is that masks, especially in children, restrict their oxygen flow and makes them ineffective, especially in a classroom setting. So if you could speak to both of those.
Go for it, Dr. Sullivan.
Yeah, so I think, but both of these questions have been studied, right? And I think, again, definitively say that there's no evidence of either of those. In fact, right, I think that there's very solid data and stuff that we didn't understand at the beginning of the pandemic that I think looking back, right, I wish we had understood because I think that would have really made a difference if the messaging had been very clear from the beginning. But the role of masks at protecting individuals and preventing spread. And I think a good example of that is last winter, what we saw is even when people were consistently and correctly wearing masks and, and pretty much across the board, we had almost no flu in our community, right? Which is typically, right, we have a lot of flu. So understanding the role of masks, not at making you sick, but at preventing you from getting sick, and not just with COVID, but with others. So there's, again, no evidence around that. And I think specifically when it comes to children, right, I'm actually a mom of 5 young children and understand, right, that they would prefer not to wear masks. They're in, childcare or school, but feel very comfortable as a pediatrician as well with them wearing them because they do not, yes, they should fit securely, right, and should cover your your nose and be under your chin, but they do not cut off oxygen, right? You're still able to breathe correctly. Again, this has been looked at with data. There's no evidence that it affects your oxygenation levels. They're considered to be safe, right? And we know that if we need to keep our kids healthy and in childcare and in school and learning where they should be, masks are such an important part of that.
That was a great question, Jenny, because that was one of the questions we had about just masks in general early on. We have members of our co-hosts who were concerned about mask wearing, and I know Jenny used a lot of analogies about Dr. B probably wore masks his entire professional career and was able to walk out without fainting. People wear masks all the time.
Well, and we've seen these mask debates now with schools going back in session, and they recycled, what they were talking about last year, and these rumors and these conspiracy theories kind of bubble to the top. They get debunked and laughed at, and then they resurface. It seems like in news cycles, and so we heard that in Asheville and in the county that Asheville sits in. Just recently, and in fact, we heard it from a elected public official that's in Congress about masks and tyranny and cruelty to kids, and equated it to child abuse, actually. So, which is just crazy. But I since we're talking about having a mask mandate probably going in effect or getting voted on today and going in effect, I believe in 10 days is what you said. The mask theories, I laugh because as I've had several friends that are retired from the fire department, and they've fought, sometimes fires that have gone 2-3 days and they're wearing protective equipment, and they're no more brain damaged from that than they are from anything else. I can tell you that much. I mean, and I think there's tons of professions that wear protective facial equipment, whether it's a dental hygienist, whether it's a firefighter, whether it's people that do
House painter.
underwater.
House
Yeah,
painter.
Painters, yeah.
yeah, house painters, people that work on offshore oil deals where they're in scuba gear for hours a day in very dangerous environments, but they wear all kinds of different things, apparatuses, and it's just kind of silly. But at the same time, it's got to be addressed. I think all these conspiracy theories at some point have to be discussed as a society and say, look, just get the shot, wear your mask, because even if masks just protect you 50% of the time, 50% is better than zero.
Yeah.
The same way with the vaccine, even if the vaccine protects you 97% of the time. 97% of the time, you eliminate the chance of getting long COVID, getting all the side effects of COVID, everything else. I would rather take 97% than 0%. And that's the bottom line.
Yeah, Jenny, those are really good points. And I think with this mask mandate, my understanding is they're going to vote tonight, but it would start immediately in Charlotte, that they have reached an agreement where it would start. Now, cities have 10 days to decide whether they want to start immediately, or it'll automatically start in 10 days. So Charlotte has made an agreement, which, thank you. You know, I don't always compliment our mayor, but this was one of the things. Well, this is one of the things that she came out right. And I'm very happy that her and Commissioner Dunlop signed that agreement, understanding. And, you know, I know CMS is going to, I don't know if they have voted on theirs or mask mandates, but I assume they're going to follow suit with requiring masks in CMS schools. And I wish Dr. Gina Navarrete was on our show today, because she has a lot of concerns she was very concerned about masks.
Not to break in too much, but CMS schools had already approved a mask policy, I believe about a month ago. Actually.
Okay, so they're mandating masks? Okay.
Correct. Yes.
Yeah. So that was her concern. Her son is in Myers Park High School. We have a lot of parents, but we're hearing this. I know I live in Old Providence.
But to make sure everybody understands, Union County does not have a mask mandate for their students, for their public schools. So, you know, again, because we have a lot of viewers in Union County and in Mecklenburg County, just to make very clear, the CMS schools does, Union County does not.
Well, as we've talked about on the show, Jenny, that's why companies aren't moving to Union County. They're moving to Mecklenburg County and Charlotte, because they know when they move here, they will have responsible adults leadership running the show instead of, you know, conspiracy people. But we're going to go ahead and kind of wind down here, because we do value everyone's time, and I'm sure Dr. Sullivan is on many of these trying to explain these things. But I do thank you for your time. You know, our Latinx community, I have a lot of confidence with the mask mandate that our community is going to pull together and honor the what is required of us, especially with our children. Because many of our families, many Latinx families, especially first or second generation, they have multi-generational households where they have a child, a parent, and maybe a grandparent or an aunt. And they understand that if that child comes home, they could pass it on to other family members. And I think we learned that, unfortunately, early during the pandemic. So I hope if our Latinx community is watching us, and Rafael Prieto, who was supposed to be on today, our Spanish journalist who is on all the time, is going to be sharing this information with our Spanish-speaking Latinx community, the responsibility we have to not only protect ourselves, but protect people that we are in contact with. And that is, as a pro-life person, that is the definition of pro-life, is saving other people's lives. So with that said, let's go around the Brady Bunch screen and tell us where you're going to be. Once again, the mask mandate, we believe, is going to be starting today. I have not stopped. If you're a sports fan, it's a perfect time in the fall to start supporting your teams, your college teams. So wear your mask. If you're a political person, it's a perfect time to, you know, share what you stand for, you know. And if you don't like your smile, it's a perfect time to cover your smile. So what could you not like about wearing masks? It's great. So Brady Bunch screen, we have Jenny, looks like Dr. B, Barbara, and then Dr. Sullivan. Tell us where you're going to be in 30 seconds or less, and then we'll go ahead and end the show.
Real quick, first of all, masks save lives, vaccines save lives. They always have, always will. As far as where I'm going to be, I have got a virtual meeting with Charlotte Pride tonight discussing our film festival. So I'm going to have a wild Zoom party of discussing feature films for our upcoming November event.
Cool. Dr. B?
Out here in Western Colorado, I'm still going to be working to improve my education about how to be an anti-racist and promote the Black Lives Matter agenda, as well as Medicare for All with a variety of virtual conferences and gatherings.
I'm going to be back up in Winston-Salem with the family that is all negative for COVID and continue to help them in their multitudinal projects. And I have a brother that got injured on the job. And so I'm trying to help him long distance for the next few days. So that's what I'm doing.
Dr. Sullivan?
Yep, and I'm not sure if I'm going to answer this correctly, but first I do, if it's okay, want to leave with one point, because I realize I went into all the nuances of isolation and quarantine, which is my job to know, and I will be happy to talk with anyone about their individual situation. But if you get vaccinated, wear a mask, get tested if you're exposed or have symptoms, and stay home if you're sick. If everyone does those 4 things, that is the safest thing that every single person can do to keep themselves safe and to protect others. So just, if you forget everything else, just remember those 4 things. And if you have specific questions, where I will be probably at work, trying to do everything that we can to keep our community safe. And I encourage everybody to call our hotline with questions. That's 980-314-9400. With any of these questions, concerns, please, we need to create situations where if you hear something, you're not sure if it's true or not, call us. We're more than happy to talk through it very transparently. And continue to provide that information, continue to provide vaccines that we offer at our health department, and continue to encourage people to wear masks.
Excellent. Well, thank you so much. I'm going to be camping in the mountains again. COVID has taught me the world of camping because I stay away from other people and I love it. So it's just, I love Zoom. So anywho, thank you so much, Dr. Sullivan, Dr. B, Barb, and Jenny, once again. I do want to say that our medical healthcare professionals, and like Dr. Sullivan and Gibby and all of the people in Mecklenburg County have done an incredible job since this. I know it's not over, and I feel for having professionals who are experts, but people question when they say something. And that's got to be really, really, I mean, no one goes to the mechanic and says, I fixed my car. Well, you need a new engine. Oh, really? Do I need a new engine? No, you just believe them because that's just the, but yet we are in a stage, and I was hoping a new president would stop that, but we would believe our experts. I know we have to get second opinions and so forth, but these are people who are paid professionals to be experts in certain fields. And I don't know, Jenny, you want to comment on that before we end? But
just real
sure.
quick. So if you do have vaccine hesitancy or you're nervous about masks cutting off oxygen to your brain or whatever, call the phone number that Dr. Sullivan just gave out, and or call your family physician. Talk to the pharmacy about the vaccines. Pharmacists are trained on this stuff. They have a tremendous amount of deal, and they can help you with your fears, and all fears are rational to a certain point. So I understand not wanting to hurt future generations of offsprings or hurt yourself or whatever. Totally get that. But at the same time, ignorance not being balanced with education is where you're going to go wrong, and you're doing the death COVID roulette play is what you're doing. You're gambling with your life. And most of all, I don't want to see anybody pass away. I don't want to see, I've lost 2 personal loved ones because of COVID.
Yep, me too.
This is the real deal.
Yep.
And love your family, love your neighbors, love people you don't even like, but get educated and get the shot. Let's stop this. The only way to proven way to slow down COVID and contain this, like any other health phenomenon, is getting the shot, masking up, washing your hands, and doing the right things. And if you get symptoms, contact a health official, contact the doctor, contact somebody that has expertise, and just be careful and be smart.
I have a question real quickly, and I know we're probably like 2 minutes over now, but I just thought about this. When our children go back to school in about 2 weeks, there are many families, especially working class families, that just don't have access to primary care physicians. Medicare for all would be a solution, but so they don't have someone to ask, like maybe we do, so to speak, or maybe they don't understand how to ask a pharmacist or whatever. Is there going to be an effort to maybe, I'm even afraid to mention this because I can imagine the anti-vaxxers and anti-maskers protesting against this, maybe helping to educate our children so they can take it home to educate their parents at home, to say, hey, mom or mommy, we learned that vaccines are, so forth, and maybe the parents would change their, I don't know, is that something that is, would that set people's hair on fire? I don't know.
Who knows, like,
Yeah, I mean, I just thought that, because I know I was raised by a single dad. My dad, a lot of the information he got was from us. And we would learn it, and we would come home and we would tell dad, hey, dad, this is, so forth. And anyway, I just thought that was the suggestion. So thank you, Dr. Sullivan. Everyone was really quiet on this one. If you're on Zoom, please stay on, but we're going to end Facebook now. Once again, thank you so much. Please mask up. Please protect your family. We'll see you next week on Coffee and Pan Dulce. Bye, y'all.